Assalamualaikum warahmatullahi wabarakatuh. My name is Kurnia Sari. I want to explain about language disorder in selective mutism. First, definitions of language disorder and selective mutism. According to Indah and Abdurrahman, 2018, language disorder is the inability to obtain and process information. They show failures in acquiring and processing files information that can affect basic language skills when communicating with others. In certain cases, this has real impact on their abilities to communicate in speech or writing. Meanwhile, according to Vandal 2002, language disorder is disorder involves the processing of linguistic information. Possible problems can involve grammar, syntax, morphology, semantics, or other aspect of language. This problem may be receptive, involving language disorders, comprehension, expressive production of language, or combination of both of them. Mm, Language disorders can affect spoken and written language and can also affect sign language. Normally, all forms of language are disturbed. Next, selective mutism or selective mute is a term for a child who consistently fails to speak in specific social situations when he is expected to speak, for example, in class, but consistently speak in situations, other social activities such as at home with his mother or fathers. According to APA 2011, classroom is often a place where children lose their speech, and it becomes really need to consider and become the most problematic thing in academic and social expectation at school, according to Siever and Courtmaker in 2011. And there are several criteria or symptoms of selective mutism in according to APA, expert from American Pediatric Association in 2011, such as first, failure to speak in specific social situations, such as school with playmates are expected to talk even if can speak in other situations. For example, speaking fluently at home or with the closest friend. Second, this disorder often education, job performance, and social communication. Third, this disorder has been present for at least 1 month and not limited to first month of school. Fourth, failure to speak in not due to lack of experience or comfortable with the language, not comfortable used in situation in the social communication. Fifth, phase of expression. When speaking, that looks anxious, scared, or embarrassed, avoiding a contact, lack of movement, cool expression when in fear or scary situation. Six, inability to speak in other social situations. Usually, people with the selective mutism use nonverbal communication to express needs. For example, nodding the head, pointing, shyness, fear of people, and unwillingness to speak. And the last, this disorder often appears in other disorders such as anxiety, depression, developmental delays, language problems, obsessive compulsive disorder, or OCD. the result of some research that hold about selective mutism. Selective mutism in mental health is reported to be low, with a prevalence of less than 1% based on APA or American Psychiatric Association in 2011. However, uh, the prevalence in the school setting appears to be higher because of the classroom is place where this anxiety disorder is most easily observed, according to Segel and Courtmaker 2011, based on uh, Facial's research. In 2018, he found that the ratio of women is 2 and men 1, while Hayden and Wilkins found that the ratio of women and men with selective mutism 3 to 1. From these studies or this research, it can conclude that the majority of selective mutism patients are women. Um, and next, the treatment for selective mutism. First, psychotherapy. One of the most commonly used method for selective mutism is the use of behavior management programs, um, such as program involve technologies such as decentralization and positive reinforcement, which are implemented both at home and at school under the supervision of the psychologist. And next, medication. Medication might also appropriate to in especially in severe or chronic cases, or when other methods have not result in improvement, or the choice of whether to use the drug should be made in consultation with a doctor who is experienced in prescribing anxiety medication for children. After we know about the treatment for selective mutism, there are some things that we can do uh, to resolve the or to manage the child in their condition. First, tell to the teacher or others around the person with the selective mutism. Teachers can sometimes become uh, frustrated or angry or miscommunication with the children who doesn't speak, or we can help by ensuring that uh, to the teachers or people know the behavior is not intentional. And next, we need to encourage the child and over price and give rewards for positive behavior. And the second, choose activities that match with their current skills. Uh, the, don't force child to get involved in the situations or social activities that require verbal communication. Uh, we should choose activities that don't, don't involve speech, such as reading, art, or doing puzzles, and etc. Third, give reward. Uh, reward progress but avoid punishment. So, uh, appreciating a positive steps toward speaking it is good, but we don't be give a punishment for the children. uh, they will not overcome if they get punishment. um, for uh, don't pressure don't pressure the child. The parent acceptance and family involvement are important to in treatment, but one should avoid trying to force children to talk, and pressure a child will only increase their anxiety level and make talking more difficult. Focus on showing the child support and acceptance. In general, there is a good prognosis for selective mutism, unless there are other problems contribute uh, to the condition. Children are generally good in other things and do not need to apa uh, get a special education if they still can nature, and social anxiety is rare, and there are efforts to prevent it. And next, the cases of selective mutism. uh, an example of the problem I'm talking about, I told from my neighbors. His name is Muhammad Fajar. Uh, he 10 years old. He looks normal and cheerful when he is at home or talking those closest friends. But at school, he becomes quiet. Didn't socialize. Use body language more often than speaks, uh, and sometimes does not respond when someone asks to him. It was he had two different personalities. This has a negative impact on him. Fajar does not have many friends because of that, and it is difficult in groups. He difficult in groups, lack of active in learning activities, get bullying and others. Okay, I think that's all from my explanation. If I make mistake, I'm sorry. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.